is Raluca. I'm a student nurse, and I am going to demonstrate how to insert an IV. We will be working on Mr. Smith today, which is getting an IV inserted because he needs to get his antibiotics prescribed by his doctor. So the first thing that we will do is we will go ahead and check the doctor's orders to make sure that we have the right patient, to make sure that we check what type, for what reason Mr. Smith is getting an IV. Because he isn't getting any blood transfusions, we'll be starting him with a 22 gauge IV. We also want to know about any upcoming surgeries to make sure that we get the most convenient spot for his IV, and also any allergies. So after we do that, we'll go ahead and get our equipment and go to the patient's room. Hello, how are you doing today? Alright, well, my name is Raluca. I'm your student nurse, and today we're going to start you an IV. Now, Mr. Smith, do you mind telling me your first name, last name, and date of birth? Alright, and that is the same thing as on the bracelet. And now, Mr. Smith, which one is your dominant hand? The right one? Alright, we'll go ahead and start you on the left one then. We want to make sure we get the most distal spot on the non-dominant hand. Now, we will go ahead and get our equipment together. Right before doing that, we're going to go ahead and wash our hands and clean us up. And then we're going to start by putting 3 milliliters of saline into a syringe. And then we're going to get our INT and we're going to clamp them together. Then we want to go ahead and flush the INT just to make sure it is working. And then we're going to go ahead and clamp it. Alright, and then we will leave these two together. Now we're going to go ahead and apply gloves. Almost there. There we go. Alright. And now we're going to go ahead and select the vein. So we're going to go and we want to go ahead and look for a soft bouncy vein. Also we want to avoid mastectomy fistula. So this one right here looks just fine. So now we're going to go ahead and apply the tourniquet 4 to 6 inches. 4 to 6 inches above the insertion site. Alrighty. Let's do that again. One more time. Alright, and now we're going to go ahead and assess for the radial pulse. And we do have a radial pulse present. Alright. Now we're going to go ahead and we're going to get our alcohol pad and just clean up the insertion site for at least 15 seconds. Ground motions. Okay. Now we're going to go ahead and let it dry out. We're going to go ahead and stabilize the vein by pulling the skins out and then warning the patient of a sharp stick. So Mr. Smith, you're going to feel a sharp stick in a second, okay? Alright, then we're going to go ahead and insert the catheter by having the bevel up at a 15 degree angle. Alright, now we're going to observe for a flashback. And then we're going to loosen the stylet and advance catheter into the vein all the way. Alright. We're going to release the tourniquet and then apply pressure 1 inch above the site. We're going to remove the stylet and throw it in the sharp container. And we will go ahead and connect the INT. we're going to unclamp it, aspirate for blood return, and there's blood return. And then we're going to go ahead and push and pause 3 milliliters of normal saline. Okay. You can go ahead and clamp this back on. And now we're going to go ahead and tape and secure our IV. Sorry about that. Okay. Do that one more time. Alright. Now we can go ahead and remove the syringe. Now we're going to go ahead and get our label ready. We're going to put the date, today's date, my initials, the gate size, and the time. And we're going to go ahead and apply it. And then we're going to go ahead and take one more time right here, just to make sure. Okay, so the label is, it is labeled. Now we're going to dispose of uncapped needles and stylets. So just get rid of everything. And we're going to go ahead and assess the patient's pain level. Are you feeling any discomfort, Mr. Smith? Nothing? Alright, perfect. Now we're going to go ahead and we're going to do our documentation. So we're going to put the time and day of the insertion, the insertion site. So this would be in the right arm, or the left arm, I'm sorry about that. We're going to go ahead and put in the size and type of catheter, so 22 gauge. We're going to do the number of attempts, which is just one attempt. We're also going to say how the patient tolerated the IV. The patient tolerated it well. And then also we are going to go ahead and state the patient teaching. So we would let the patient know to advise us if they feel any redness, any swelling, or any discomfort in the insertion site. And that is it.